Hi everyone, I'm going to walk you through how to assess a child for malnutrition and failure to thrive, and then once you identify malnutrition or failure to thrive, we're going to talk about how you would develop a plan for treating that failure to thrive or malnutrition. So in this example we have Carlos. He is a term infant who is now 14 months old. And his birth weight was 8 pounds 6 ounces, which works out to his plotting at about the 75th percentile weight for age at birth. His current weight of 18 pounds should appear obviously low to you because he's more than a year old and he weighs less than 20 pounds. His living situation shows us that he's living in an environmentally difficult circumstance. He's been living with his teen mother and her boyfriend, and he's been taken out of their custody and placed with his maternal grandmother for reasons we're not sure of, but probably abuse and or neglect. You also identify here that he's still entirely bottle fed, which is not normal for a toddler of greater than a year of age. So first we're going to establish his growth parameters, and you can see that he is less than the 5th percentile. He is 2nd to 5th percentile weight for age. His height is on the low side, although not less than the 5th, and his weight for length is also less than the 5th, or the 2nd to 5th percentile. That means his weight makes him the size of a 7-month-old. That's his weight age. His height makes him the size of about an 11 to 12-month-old. That's his height age. So, if we're looking for failure to thrive, which is kind of this older definition, Carlos meets that definition because he is both low weight for age less than the 5th, and he's also had weight deceleration that crosses 2 percentiles on the growth chart. So with both of those, he does meet the definition for failure to thrive. Now we can also look at the definition for the new malnutrition guidelines, and if we use the single malnutrition guideline and we look at where he is on the WHO standards, we find that his weight for length z-score is minus 1.8, which puts him at mild malnutrition. Now we have more than those indicators with him, so if we look at the 2 indicator score, we find that he both has had a deceleration in weight for length or height z-score, or we expect that we would. That's pretty significant. I don't know absolutely without having his birth length. And we're guessing that his nutrient intake has been inadequate. So again, he's somewhere in the mild to moderately malnourished category. All right. The other thing, and I was just going to show you real quick, the WHO definition where he meets that criteria. Okay, so if we were then going to estimate his energy needs, because he's malnourished and failure to thrive, and he's low weight for length in particular, we would want to establish catch-up growth for him. But for practice, we're going to estimate his energy needs for maintenance or growth without any catch-up. So to do that, we can go to your children's handbook, and we would go to page 26, and we would find the EER equations. Now, we would expect him to grow more like his weight age, so like a 7-month-old. So in the 7 to 12 month, that means he would need about 81 calories per kilogram. Now, he is not the size of this average reference weight, so we could use the equation and put his current weight into this equation. And if we do so, we find out he needs about 79 calories per kilogram per day just to keep up the normal growth trajectory of a 7-month-old. So 79 to 81, depending on whether we use the average from the chart or the equation. But that's not what we want to do because he is low weight age and height age. So instead, we're going to use the BMI method of getting ideal body weight. That's from page 17 in your children's handbook. And that means we would go to the growth chart. We would find, his length, which I believe was 75 centimeters. And then we would go up to find his weight, and that puts him over here at 9.4 kilograms for his ideal body weight. Our equation for failure to thrive for estimating needs can be found in your children's handbook, again, this time on page 29, and it says that you need to determine his calories required for his weight age, multiply by his ideal weight for height, and then divide by his actual height. So to do that, you again go back to page 26. You can find, either use the formula for his weight age, or you can use his average, and that's because his ideal body weight, 9.4 kilograms, is the same as the one used to calculate the average ER for that age. Either way, you would then multiply it by the ideal body weight and then divide by actual weight. And doing either of those methods, we determined that his needs for catch-up growth are in fact 93 calories per kilogram. So that's a big difference to go between 81 or 79 and 93 calories per kilogram. Also recall that in estimating his protein needs, we also need to multiply the RDA for protein, which also is found in the children's handbook. We need to multiply that RDA by his ideal body weight, and that's on page 31 in the children's handbook.